Hello once again, it's Dr. Vyas. It's Thyroid Tuesday, and now today we are actually going to put together all this information that I've been putting forth in the past few videos. We talked about all the causes of the hypothyroid problems. Now I'm going to show you how we can actually start treating or reversing this whole condition. So today we're going to start with a few things, just a few quick notes, because I want to actually expand on some of these things a little later. So for right now, I'm going to start off with two main ingredients. That's foods that are wonderful as natural therapies for hypothyroid problems, and there are nutrients that are actually wonderful that your body needs. Again, we've talked about all these few small micronutrients and nutrients that your body needs to help this process go the way it should. So first things first, let's start off with some of the foods that we're needed. First thing is your omega-3s, your fish oils. We've heard that omega-3 is actually one of the supplements nowadays because it's anti-inflammatory in nature. It's actually good for your hair and nails. It is wonderful for every kind of cell in your body. It also helps lubricate your joints. So you can imagine how much of a wonderful supplement omega-3s are. What we like for omega-3s is your fish, your salmon. Salmon is wonderful because it has high in protein, high in good fats, and low in your carbs, of course, that people are concerned about nowadays. So salmon, and we also recommend getting the wild caught salmon. You don't want to do any of those farm raised because again, they have those other issues with your mercury poisonings, and they're not as nutritious as they're supposed to be. So omega-3s from your fish, from your healthy fish or your fatty fish, your salmon especially. Second thing is seaweed. Seaweeds are things like your kelp. We also talk about something called spirulina, chlorella. These are very high in not just your micronutrients, your green super nutrients, but also have iodine content to them. They're all found in the sea, and anything in the sea has a lot of iodine in it. And if you remember from our few videos, you realize how important iodine is as a nutrient for hypothyroid conditions. So to incorporate food or to get iodine from your food, seaweed's a big thing. Yes, sometimes people complain that it's a little fishy and they don't like it, but there's all sorts of different options. The way I said, the spirulina or chlorella also come in pill forms. So you can actually just take a pill and you don't have to worry about that whole fishy taste or smell. The third big thing is we need B vitamins. B vitamins are essential, and the best source for them is eggs. Eggs, again, organic, the free range eggs, much more important or much better than any of the regular ones. But I suggest eggs because eggs are a wonderful, especially the yolk. People usually eat egg whites and throw the yolks away, but yolk is where most of the nutrients are. So you've got to have yolk. The egg yolk is the best part. It contains your B vitamins, your thiamine, your B12, all these B vitamins that your body requires. And the other good thing is it also contains phosphatidylserine, phospholipids. These are all other ingredients that are brain boosting. So they're wonderful for the brain itself. And we had also shown you how the brain connection with the thyroid is important. So we also got to get the brain working the way it should. And that's where your eggs come into play. One other thing is your darker berries. Anything that has a dark color to it, your blueberries, your blackberries, your pomegranate, they have something called cyanoxanthine, which is an active antioxidant for the body. Antioxidation or oxidation is a process where your body is breaking down itself. Antioxidants are wonderful because they actually help correct that whole free radical story. I'll get into that in a little bit in more depth in the next video here. But these are some of the 4 main foods that I suggest that anybody with hypothyroid problems start getting on. Now we'll also go with a quick few of some of the nutrients that are required. So we talked about the biggest one, iodine. You may get some iodine from some of the foods we talked about, just from your seafood or your kelp, but you may not get enough of it. So we had talked in one of my old videos again about a simple at-home patch test that you can do to find out how deficient you are in iodine. Depending on your deficiency, we can actually dose the recommendation for iodine for you from there. Usually iodine is a micronutrient, so it's required in what's called micrograms. So very tiny little quantity of it. 100 to 300 micrograms is what I suggest for this, for iodine. When you buy iodine, you can get some good iodine supplements. We carry some in our office as well too. But the way I said, to dose it the right way, you got to know how deficient you are in it. Iodine is wonderful. You don't want too much of it either in the body. So we'll go from there. The next micronutrient is something called selenium. Selenium is a wonderful thing. It has recently there's been so many studies on it, and they've also found it to be a good anti-cancer agent. So they've shown that when you have enough selenium in your body, or if you take more selenium, it actually helps with certain kinds of cancers. So again, a very important nutrient right there. For this, we suggest about 200 micrograms. Now, you can buy selenium in the market. Usually they have something called the RDA, the recommended daily allowance, that you read in the back of the bottle. I usually suggest taking 2 to 3 times more of the recommended daily allowance. Usually those RDAs are for somebody that, maybe just sitting at a desk doing nothing much in a day. So it's a very small recommended daily allowance there. For somebody with hypothyroid problems, 2 to 3 times that would definitely be more beneficial. So selenium, we want about 200 micrograms of that. Big one, vitamin D. I've talked about vitamin D all the time. Vitamin D is a precursor for all the hormone formation in your body. So it is very required. It's not just for your bones and all that, but it is a big nutrient that is required by every hormone or every cell in your body. And now people, the way we are here, we live in the northern hemisphere where we don't see the sun too often. So we definitely need to supplement. The other question I always get is, how much should I be taking? Well, I suggest 4,000 to 5,000 IUs. It's international units. That's the measure of vitamin D. So 4,000 to 5,000 IUs on a regular basis every day. You can go a little bit higher in the winter months too. You can go up to 10,000 IUs because everybody's very deficient in vitamin D. So up to 10,000 IUs a day during the winter months. In the summer, if you're outside, I would still suggest staying close to about 5,000 IUs a day. Because when you're through blood work, if you've ever found to be vitamin D deficient, they actually put you on something close to 50,000 IUs of that. So just taking 10,000 IUs a day every day is not going to make you, overdose on anything. So vitamin D, very essential. And then we come back to the B complex. Recently, studies have shown that thiamine and B12 are wonderful nutrients that are required for the thyroid to function the way it should. For it to be producing your T3 and your T4 cells, it needs vitamin B. So a good quality B complex. We don't always try and, there's 25 different vitamin Bs. So you don't want to be taking 25 different pills for those. A B complex will actually supply you enough of what your body requires from that. Again, we carry a good supplement in those things too. So we'll show you how much you need just according to certain tests that we do. Now, in our office, we've always had this saying where we say we don't just guess, we test. So for all these things, just to find out how deficient you are, we will actually test all these levels to find out where you are and then suggest a dosing according to that. Not just saying, oh yeah, here you might just need 3,000 IUs of this thing. So if you're interested in any of these things, and again, when you find this information helpful, please share it with your friends. We just want to kind of educate the people and let them know that there's a lot of different options. You don't just have to be stuck with taking pills for the rest of your life. There's a lot of healthy stuff, all natural remedies that you can do yourself that'll help you take care of your hypothyroid problem. Now, this was just one part of it. In the next video, I'm going to be showing you a lot of other herbs that work wonders for anything with your hypothyroid problem. So share this video and watch out for the next one. Thanks.